Okay. I believe we are live. Okay, you guys can hear me okay?
Yep.
Yes.
Good.
Yep.
Okay, so welcome everybody. This is Conscious Comedians Journal Club. My name is Dr. Ellen Wesley, which you probably know because you're tuning in. I'm an emergency medicine physician from Chicago, and the purpose of Conscious Comedians Journal Club is to provide good information without intimidation, because you are the master of your body, and I believe, and we believe, that the more knowledge that you have, the more empowered and able you are to navigate all the craziness and all the challenges of today. I would like to introduce our guests today, my colleagues, Valerie Jencks, a therapist, also comedian and producer, and Nico Schwartz, EEG tech, also comedian and producer, and our guest today, Dr. Margot Gage, Witvliet. Tell me how to say it again. I messed it up.
Witvliet. It's okay.
Witvliet.
You're
Witvliet.
fine.
Who has a gorgeous family, two beautiful little daughters. Anyway, Dr. Margot is a professor and epidemiologist from Texas. She's in Beaumont, Texas, about to fly away from the hurricanes. And all of us have had COVID-19. All of us, mine are the least, but all of us are experiencing some degree of extended symptoms, that which we call, and we talked about 2 weeks ago, long haulers. Dr. Margot is going to talk with us about her experience having COVID-19, her experience with the symptoms that she has now, and we'll all talk a bit about what happens. Everybody's experiencing. Val and Amy both are experiencing long hauler symptoms, and one of the other things that we'll talk about is where are physicians these days, and how to get the most of your doctor visits, because the honest truth is nobody really knows about everything they need to know right now, and so the more knowledge the patients have, the better. And welcome, Dr. Margot, and welcome, Val and Amy.
Thank you for having me.
So when again, first tell us you're in Beaumont, Texas, and you're a professor at Lamar University and also an epidemiologist. So how does your epidemiology and your teaching, how do those things interact?
In what way do you mean?
Okay, so I guess the first thing is, how does your epidemiology work look? I guess that's the best question.
For me, it's research. So I'm a teacher and a researcher, and I like to bring data into the classroom. So my students read a lot of research reports. I have carried out studies using, for example, World Health data with over 250,000 people. My background is everything about health. I look at all types of factors, societal factors, for example, that can impact your health and how health is doing in different countries. So very comparative studies as well.
So I should explain, epidemiology is, I'm fascinated by epidemiology. I love it because epidemiology is a study of how disease lives, how it grows, how it goes around populations. For example, with COVID, who gets it, what predisposes them to it. Epidemiology is just a fascinating science that helps us to understand disease.
Yes, and I like to call epidemiologists disease detectives. And so with COVID and it being a pandemic, it sounds a little bit morbid, but this is what epidemiologists live for. This is what we study. And then to see it come to life is quite interesting for us. And so for me to become a subject was quite a bitter pill to swallow. I'm used to observing my data, not being part of my data. But I think that also helped me during my sickness process, because, as you just mentioned, the doctors a lot of times don't know. This is all new to them. So then I just, went back into what I've been trained to do and started looking at what was happening around the world with COVID. So not just in America, because from what I noticed was that just how the disease had traveled from east to west, so was the knowledge.
Oh, interesting. Wow. And wouldn't it be nice if we weren't so politically messed up, because we would be benefiting from everybody else's knowledge? Gosh. So, I get so frustrated.
That's a whole other broadcast, Dr. Wesley.
No, actually, the good news is the conscious comedians, we don't have to do that. But I did take the ADD medicine. I did. It doesn't. Oh man. So you may have to stop me, because I do have ADD. Yay. So I think of myself with this stuff sometimes as a walking epidemiology lab. But I mean, that somehow gives me more peace, that when I have some illness, I can understand it better, so that I know how better to interact with my patients. But that means when they can't breathe, I hold my breath, and truly, but it's frustrating. So, so you tell us about, Dr. Margot, when you first started to feel sick. How did that happen?
I had just gotten back from a flight from Europe, and we did a multi-country trip, and we, really deliberated, but had decided to go ahead and fly out. And so we did that. And shortly thereafter, I started experiencing my first symptoms. My whole family became ill, but for them, it wasn't that much. It wasn't really big deal, especially for the kids. They were, it looked like really bad allergies for them. And then I just kept getting sicker and sicker. And so by 2 weeks, or, by my second or third weekend back, I was in the hospital for the first time. So my health deteriorated rather quickly after getting back.
And the doctor wasn't sure if it was COVID or not?
Well, how it went was, when I went to the emergency room, they suspected me for COVID. When I went to the ER, they were prepared for that, all in their gear. COVID testing got done, flu tests, all whole 9 yards. And then, because it took a long time to get your results back, they just sent me off, and I didn't hear anything back for a while. But then when my test came back and it was negative, this was a non-FDA approved test. I was one of the first ones in Texas to get tested. It was an in-house test. But my doctors, because they're like, this is a test, you failed it, so you don't have COVID. And it was just like very black and white for them. So, but for me, I'm like, yes, but there's, false negative. Yeah, it's possible that your test is not accurate. And then later on, it started coming out that these, tests were unreliable, especially these early tests. But the doctors really held fast to that. So I got diagnosed when I followed up with a specialist, he diagnosed me with a respiratory illness, and completely ignored all of my other symptoms. He just focused on the fact that I couldn't breathe. They called me like a COVID, I don't know, or something about
person of interest.
Yes, yeah, they called me that, and I got a Z-Pack, and I got the anti-inflammatory medicine. So they were treating me, in the same manner that they would somebody who got contacted COVID, but they were not saying it in that, like that. And so it wasn't until then I landed back in the hospital. I went back to the hospital because I couldn't control my breathing again. And they thought I had blood clots. That's how I presented to them. And the nurse said, I have been doing this for, 30 years. You have blood clots. And then when the test came back that it wasn't a blood clot.
You have a normal D-dimer?
All of my tests were normal. Everything was good.
And
so
I'm sorry to interrupt, but I just want to, I know that you wanted to talk a little bit about the gaslighting today.
Not yet though, because the first thing that I want to hit on is I wanted to ask, did anybody tell you, did anybody give you breathing exercises at all?
in the beginning,
Yeah,
no.
because
It wouldn't have also been possible for me to.
well, not really. What happens is if they would recognize, and I'm not, I do my best to communicate on this one, but the quality of the difficulty breathing with COVID is different than anything else. People that are asthmatics, people that have COPD, people that have, and so for somebody, PEs are weird. For somebody to say they know you have a PE is BS. But if you watch somebody breathe and you watch somebody that can't breathe, I mean, I'm lucky I have asthma, so I kind of know what that looks like. And also having had COVID in that experience, you see a really different reaction. You see a different thing happening with the chest if you're a clinician, if you know how to look for that. And there is a really good post from a British doc about a breathing exercise. And my concern is the focus is everywhere but that, and it's a very simple thing. And I use this as a platform to communicate it about, but really the very most important thing is to teach people, look, this is what kills people. This is what gets worse that makes it dangerous. I mean, even all the stuff that people are having, the stuff that kills you is when the breathing gets bad. And this is what to do in order to track your breathing. Now, a lot of people bought pulse oximetry, but there is what happens, the way I experience it is with asthma, for example, or COPD, it's like breathing into a paper bag. With COVID, it's quite different. And it's like you have two wet bed sheets, and you know how heavy they are, and how you try to separate two wet bed sheets? That's what breathing into my lungs with COVID felt like. There was something heavy, and there was a kind of shortness of breath. And looking at patients when they come into me, the quality of chest wall movement, the looks on their faces, people that are accustomed to shortness of breath get a kind of panic that when it's COVID, when it's bad COVID, and I know because of the way the panic looks on their face, this is different than anything they ever had before. And
Yes.
the thing is, if we would focus on that with people, because what's happening and what really upsets me and worries me is, guess what happens when people can't breathe? They panic.
Yes, and that happened to me as well, is that I would panic because I couldn't breathe. So you have that panic factor in there as well. But I would train myself to calm down as far as not, trying not to panic, but you still have that painful, tightening, squeezing feeling that you can't get out of.
What helps the panic though? I mean, and what happens is the clinics tell you you're panicking. The thing is, that's the time to do the breathing exercise. The breathing exercise involves taking deep breaths, holding it, and then a forced cough. So if you take like as deep as you can, let it out 4 times, and on the 5th, hold it if you can, and then a forced cough. Now, when I was feeling particularly bad, I did that 4 times an hour. The other thing that'll happen is, because there's so much edema and the way that the edema is in the lungs, there's a lag in oxygenation. So the waves and the relative oxygenation is bizarre. There's a delay in diffusion. So even after you intubate somebody, if you intubate them well, respiratory has told me, hey, it may take a while for the oxygen to come up because of this diffusion impedance. So what will happen with the pulse oximetry, that thing that they describe as happy hypoxia, part of the hypoxia is because of the diffusion problem, because of the edema. The other part of the hypoxia is, that I don't fully understand, has something to do with red cell metabolism. So people get panicking when they feel the physical sensation, but that panic should tell us to tell them to do these breathing exercises. I mean, that it indicates, the panic indicates that we need to do something about it. So anyway, so sorry for interrupting you, because I do want us to go to gaslighting, but I mean, the gaslighting issue is basically a doctor, clinicians think, if I don't see it, it doesn't exist. It's a defense mechanism for people that are used to knowing everything. It can be power trips. It is a symptom of burnout. I mean, it's all kinds of horrible things, but basically you blame the patient when you don't know. You know, I get in fights with doctors because I don't, you know, I see that. And it's so intimidating. You know, I'm prey to that too. You know, oh, he's a very confident doctor, I must be an idiot, you know. So anyway, the gaslighting issue with this is partly, you know, that's why I want us to do this. Anyway, so go ahead, I'll shut up.
Okay. So no, my doctor never gave me in the beginning any breathing techniques or, you know, things of that nature. And he actually said when I was in his office, because he was thinking about testing my breathing, that he didn't think it was possible to do it. So that's his words, not mine. But for me, my breathing, it was pretty debilitating. There was a couple of times where I didn't think that I was going to make it. It got, you know, pretty bad. So,
I could tell
that was
from
then.
the tape that part of the time you were home, I was watching the color of your lips. So right before you went to the hospital, they were pink, and then I saw that your lips were pale. So I knew you were hypoxic at some point.
And that's interesting that you say that. But those parts in the film are not the worst, like, because, you know, there's filming going on. But when, you know, when the cameras are off, that's when, you know, I got to the dangerous levels. The parts in the film is kind of just how I was living the entire day. And then I would get this, you know, episode, as I call it, where, you know, it was just, you know, when we were like that. So, it's, yeah, I don't like thinking about it so much, but,
so we were talking about the pulmonary stuff. So the long hauler stuff. So Amy and Val have both been experiencing that. Amy, how has your experience been when you were talking about when you first had it? What were your symptoms? What are your long hauler type symptoms feeling like now?
I get shortness of breath really easily, and like prior to getting sick, I was doing a lot of Krav Maga, so I was in pretty good like physical cardio shape. And at first I just thought like, oh, I was sick for so long. I was sick like, you know, 3.5 weeks. I'm just got out of shape. So I went back to Krav, but I was really struggling. Like I almost passed out in one of the classes. I felt like I was gonna, and then, you know, even just like simple jogs I used to do that were an easy, short, like mile jog, I would get so winded. And then I like started tasting when it was like certain days after I would just push through it, because at the time I didn't really think I had COVID since there was no test and it wasn't supposed to be here, you know. So I was just told I had like multiple colds in a row and crazy fevers. And so anyway, so I just pushed through it, but then I would start to get this metallic, almost blood taste in the back of my throat. And I was like, that's definitely not good. It's not that cold outside. And then I just started noticing getting out of breath, just even simple things like going up steps, which normally I like go up a lot of steps in my day to day. So that's been the main thing. I would say like a month after maybe, I had like brain fog where I couldn't remember things. And then that was kind of concerning. And I think my family like thought I was depressed because I was still fatigued. And, you know, you don't think of like memory issues with like getting over, you know, respiratory illness or flu. So, even though I test negative for all the flus. But yeah, so it was like, those are the things I noticed in the beginning. Now I think it's still just a little bit of the respiratory. Knock on wood, I feel like the fog has kind of gone away, so that's good.
Mm. How long again? How long are you sick?
I was sick like 3.5 weeks.
And when did it start, Amy?
It
Yeah,
was
that's
like
what
the
I
end of
mean.
September, October. So that's why I didn't think I had COVID. But then the more and more like things came out about COVID, the more would match what I had. Like even the patient that I had, that I believe I got sick from, I had a couple days before, had the rash like that children have, and also the febrile seizure, and the patient wasn't eating, because I remember the mom was really concerned. He hadn't eaten in like 2 days, and then so later I would hear more and more like, this is now a new symptom in children, now this, and it would just all kept matching the patient I had, and then things all had matched what I experienced.
It makes sense. I mean, and of all the febrile seizures, I haven't seen a status febrile seizure either.
Yeah, I had
So
never even
status
really
in that.
heard of someone going into status from febrile. Like usually, neurodiagnostics, we hear febrile, we're like, oh, they're EEG, probably normal, we'll just check it to make sure. And when I did this patient, he was so hot, I came out just pouring sweat, because it felt like I was like standing over a bonfire when I hooked him up. So yeah, so now it seems like it all makes kind of sense that that's what it was. So yeah, so it's been like quite a while since I had it, which I never was able to get tested, but it sounds like I had it. So yeah, so it's been a while. So luckily the brain fog is better, but the lung issue lingers. I do have allergies, so I have a little bit of asthma with that. So I'm hoping when the ground freezes, maybe I'll breathe a little better, because my asthma should be a little better that time of year. So we'll see what happens with that.
Wow, and Val was super duper active. I mean, she's like a freaking Wonder Woman there. And how did yours go again?
Well, I initially got sick on March 15th, and up until that point, I had been training for the marathon. So I had been running about 4 to 5 miles every day. It started out with a tickle in my throat, and I just, around that time, New York was starting to pop, and around that time they were starting to think about sheltering in place, and I thought, oh, I think I'm just gonna self-quarantine. And there were a lot of people around me that are just like, oh, you're being too dramatic. And I'm like, oh, no, it's a weird tickle. And by that following Monday, my head was ready to explode. I had the worst headaches ever. And I describe, my fever never got that high. My fever never got much over 100, but my insides felt like somebody had taken a cheese grater to them. It was just this pain that I've never experienced before. The headaches were there, the fatigue, and then I felt, and I was watching one of Margot's tapes, and I related to this so much. It felt like an elephant on my chest. I did not have a productive cough. I had, kind of a dry cough, because the throat thing just felt really funky, but that heaviness in the chest and the upper lungs just felt like they were burning. And then I started to feel a little bit better, but the fatigue never got better. And I've had all kinds of weird lasting symptoms. My legs and arms are tingly in the morning, where sometimes I don't have feeling in them. The brain fog has actually gotten worse in the last month, where I'm really having a hard time sometimes with word retrieval. And, for all 4 of us here are educated women. And when you rely on your cognition as a way of validating your identity and who you are, and then that goes away, there's this extra layer of trauma that I think we're all experiencing. It's like, no, really, I know that word. I couldn't remember the word black the other day, and it's like, really. So that's my story.
Well, and you were saying, but also too, when you said about after how much you were running, share how
right.
long you can. How long can you run now?
once the fever went away and I was pretty sure I wasn't going to be contagious, I'm like, well, I'm going to go out and I'm going to start running again. And I would 30 seconds, 60 seconds. And I describe it as feeling like, when you take your dog for a walk and your dog just decides that it's done and it just stops. That was my body. It was just, I'd be running and running and then all of a sudden I'd stop. And so then I started to take my pulse oximeter and I was registering 73%. My saturation was depleting, into the 70s regularly. And then it would recover within about 15 minutes to a half an hour to the 80s. And it would be a full couple hours before I'd get it back into the 90s. And I'm
that after running or even before?
After running. And I'm still having that issue.
You take it regularly so you know what pulse ox looks like?
I actually brought it to show you tonight. So this is
love it. They were sold out. I was looking on Amazon.
They were sold out when I first got sick. They were actually on sale for $9.97. Then they got sold out and now they're back on the market for $25. So
wow. I will get it. Oh, and right now, so your regular resting pulse ox is what, 90s?
92. Prior to this, I was always at a 99 or 100. And now my regular oxygen saturation is at around 92 without exercise. If I exercise, it usually dips down to 87.
So the crazy part about it is, I say the scientific we in general, it's not known what's doing this unless somebody goes down. I think you'll probably learn more from Dr. Goralnik about the physiology or the histology of it, but it could be persistent edema. It could be some scarring. I mean, it could be, my concern is that this vasculitis, this autoimmune thing that is producing these rashes, is also present in the lungs because it's a vasculitis and the cytokine storm they talk about. And I think, part of the question of is what is causing these long hauler symptoms? Is it tissue changes from the virus itself? Is it persistent virus? Is it blood clotting? We talk here about that. And I think it's probably some of all of the above, but a good deal of it. And it's really so difficult to define, but that it is, I still think, this persistent autoimmune craziness in the body. So,
this is why I was asking Dr. Margot about her D-dimer, which they will do, to check for clotting, because a consistent conversation across all of the long hauler boards is that our tests are coming back within normal limits. There are a few people that are lucky enough to actually have a positive finding on a test, but for the most part, a lot of long haulers are having these very real physical symptoms, but all of the laboratory tests and scans that are being done that we know to do are coming back within normal limits. And so there's this.
So
I think that's contributing also to the gaslighting that you're experiencing.
No, I don't think the D-dimer is, I'm in a unique place because I see people, I get a good sense diagnostically, and then I order whatever I want and I get it back right away. I was using the D-dimer as an indicator. It's not always reliable with it.
Interesting.
I wish it doesn't. And I think that there's different physiologic responses depending on what system's more affected. Like I had a girl, and so I do it all the time because I think, I've got this, I recognize this, I'll get a D-dimer, and it's not helping. It's more accurate than the reliability of the test, that's for sure. But the sad stuff that really frustrates me is the GI presentations. And I really am starting to think that if you don't look at the stool, you're going to miss it. They don't shed respiratory wise. And this poor girl had been in for epigastric pain. Now, I knew my very first symptom, I didn't even believe it, my smell went away. Somebody had opened up an abscess and my smell doesn't usually work very well anyway. And I kept thought, what are they talking about? And the nurse said, don't you smell that? And then the next day I had a headache, crazy headache. I get headaches. And then I had trouble swallowing. A pill got stuck. And I looked and looked and looked, and I thought, is there esophageal dysmotility? Well, I couldn't find it, and I did find that there is ACE receptors on the GI tract, especially in the small intestine. But this girl that had come in to me, epigastric pain, absolutely esophageal spasm pain, came in, got all the kind of stuff, right? And I was the third person she saw, and the nurse was rolling her eyes a little bit. And I went in, and fortunately, I can see right away if the patient's gamey or nutty. Not that I'm not nutty, but, I could tell right away this person looks a little toxic. And she'd been passing out, whatever was going on. I think she vasovagal because of the esophageal spasm, but I was able to reassure her, because the CTs were negative, whatever. And I said to the nurse, you know what? It was a nurse practitioner, and she's wonderful, but she's one of those linear-minded people. And I said, please do the COVID test. And I went to this girl, and I said, look, I've got you. And she also, minority person, so she's the poor thing, is like ready to be undervalued altogether. And so until that COVID test came positive, I said, I'm not going to make you go home. I know that we have something here. And this girl just started to cry, please. She says, oh, I only came because I was afraid I'd pass out and no one would find me. Lucky thing, her COVID test was positive, but the GI presentations, anyway, and I called all over the place to see, does anybody do a stool test? I saw Mayo did one, but I got to find someplace. So that it's just so frustrating. And my concern is that people are more miserable than they need to be, and people are dying because they don't have the right information.
Well, and as Dr. Margot pointed out earlier, because this is such a new virus, we don't have a standard of presentation. And so early on when I first had it, you just reminded me, I had all kinds of gastro issues. I was running back and forth for 2 days to the bathroom, and that was the grounds that they dismissed it as not being COVID. They're like, oh, we don't have a test, but don't worry about it. It's not COVID anyway because you've got these GI problems. And then a month later, there it is. All the GI symptoms are on the standardized diagnostic criteria. So it's just.
I had the same problem.
Yeah.
I didn't have a fever ever, for example. So that's why I was discounted, because I didn't have a fever and my cough wasn't persistent enough.
Right.
Yeah,
I didn't
really high fever and chills, but people kept saying it doesn't affect children, and children aren't like transferring it to you. And I was kind of like, I'd already read in China that people were saying it didn't affect children. Then later there were children dying. So I was like, I've already read on this. It's, so early on, I remember, like you said, with knowledge traveling, it was just weird. It was like the same rumor in the beginning got here. It was like, oh, children don't really get it and pass it on. And I just thought that makes no sense. Children are always usually carriers. And then, of course, we already knew from the research in China that wasn't really the case. So, yeah, it's interesting what makes people rule stuff out,
Well, so two things we talked about, and Margot and I talked about this too, that the list of symptoms needs to be widened and clarified, and the list of tests that need to be done needs to be absolutely delineated. That's not, the chest X-ray or whatever. That's probably something that's on the forefront, but those are things that we could contribute to, that Dr. Margot can contribute to, because they'll listen. You're in a position that, because you are a researcher and you are involved in academia, because I think, the idea of what does it look like, what are the symptoms, and what do we do to figure out what it is, I'm really worried. The symptoms part will probably be accepted earlier than the testing, because it's going to be a lot easier for people to say, oh, no, you don't have it, because hospitals are losing money, and because it's vague and it's more convenient for the people, So, something we can contribute to the discussion is that.
Absolutely. And I know with my children, for example, who, it didn't really affect them too much. But what they did tell me yesterday, 2 days ago, it was they ran to the stop sign, for example, and they were completely out of breath, which is very unusual. So I just said to them, okay, but I'm thinking in my mind, oh, it's quite possible that they're experiencing long-term symptoms because there's no reason in the world that they should be out of breath to run to the stop sign.
So pulse oximetry would be a good thing to have at home for the heck of it, because that'll be a way to track it. And then, the other thing is, that's a good way to not get gaslighted. Your logic. The other way to not get gaslighted is if the doctor doesn't, if your experience is that you're not being heard, then that's not the right practitioner for you. It's hard to go shift and get another one, but the minute you see the shade go down that they're not hearing you, that's, you can't give up.
That's what I had to do. I had one session with a doctor because I went with my husband, who spoke with my husband the entire time, and even asked about my symptoms to my husband. And, and I was just like, really? So
yes, really.
Yeah.
I'm sorry.
I found a new doctor.
It's just like, it's so relatable. It's wow.
Oh, you guys will love this. I don't know. I'm trying to figure out how best to react to it, but I was at the end of a very long shift last week, and we just happened to have a guy come in with an active MI, and there was a guy also fixing the floor. And he came to fix the floor by my desk and said, "You're going to have to move." And I said, "I'm the only doctor here. It's going to be kind of important." And this sucker, I had to fight with the idiot who was fixing the floor because he was mansplaining me. And I said nicely, I have a patient having a heart attack here. He couldn't have cared less. And then I had to deal with the cardiologist, who was a whole nother same deal, and I felt like such a nut because I had esophageal spasm when it was all over because I was holding my breath. But there's nothing you can, I wish there's nothing you can do but figure out how to finesse it in terms of how do you work this person. You have to figure out how to interact with this person because you don't have time to go get them in trouble first, and it's all about convenience. That's a sad thing. There's a religion of convenience. And if you become the squeaky wheel, people stop listening to you unless they're really dedicated. So pulse oximetry is good to have at home, but lists of symptoms and the lab stuff, I'll start looking at that stuff, because there isn't a good, and I think too, when you find a clinician like Dr. Gralnick that Val is seeing at Northwestern, this guy's an infectious disease guy and a neurologist, and so his particular awareness, he'll probably have a better idea. And he's open-minded, he's a very humble guy.
Well, one of the things that it's Korolnik.
Oh, Korolnik, sorry.
One of the things that he was explaining to me was that COVID seems to be affecting three systems: the brain, cardiopulmonary, and the digestive. And so his particular laboratory is looking at the immune responses effect to the interaction between the T cells and inflammation, and within these different systems and vascularity. So it'll be really interesting to see what he comes up with. I actually found his name off of one of the long hauler boards, made a call to see him, and they couldn't, this was a month ago, they couldn't get me in until February. And I live here in Chicago. Well, luckily I live here in Chicago because they had an opening like the next day in the morning, and they said, we have this opening, can you take it? And so I was Johnny on the spot right in there. I was like, yes, no, I don't want to wait until February. I'm a lot concerned about the thousands of people that are sitting at home with all of these long haul symptoms, who aren't getting answers, who aren't getting relief. And so, I'm a therapist, so I'm concerned about the psychological impact, as well as, is there any kind of degenerative process that might be taking place as there develops a chronicity to these long haul situation.
That is the guide. That is the guide to learn that from. Wow. Boy, I'm surprised.
sharing data. As Dr. Margot said, we are not at a time where this is not the time to be cutting off communications with other countries and other scientists. This is the time to be opening everything up, regardless of any kind of national affiliation, and sharing.
And I think also, the mental health aspect really can't be ignored, because there's also mental health issues just with having COVID, just different neurological issues. And we hear a lot about the physical symptoms and, not so much about the mental health aspect. So I think that needs to, be recognized as well. You got people like you have a lot of work to do in the coming time and need to be part of the story.
I think my way out of my paper bag. No, you're absolutely right. I know just over the last month, I've, as the fatigue gets to me, as I'm not able to process things at the rate that I'm used to processing my thoughts, I've paused and asked myself, are you depressed? is that what's going on here? Because it really, it hits you at so many different levels, COVID, that you really, I think, once you're through the actual physical disease process, there's a lot of stuff that lingers mentally. Hope that made sense.
It makes total sense, because people are exhausted, and then on top of that we're pulled out of our usual interaction in society anyway. There's a lot of just all kind of waves of change that we have to be open to, and to learn how to support ourselves and support other people, and how do you interact with patients about that? People don't know. People that are not aware like we are, they have no idea.
Ellen, I'd like to also bring up something that I hear a lot of happening, and that is that if any of you remember when the AIDS epidemic started, there was this fear where people who were diagnosed HIV positive were completely avoided. They were treated as if they were just the scourge of the earth. And we're finding that that's a lot of what's happening with people who have had coronavirus and recovered. That I'm hearing, I just read an email from somebody whose child had coronavirus a month ago and has been disinvited to the family reunion because everybody was so, and I'm thinking to myself, okay, it's ludicrous to me that you're even contemplating having a family reunion in the first place. Now you're going to disallow the one kid who probably is safest to be around.
Oh my God.
So there's, we've got the gaslighting that's taking place. We've got, this virus that's kind of like herding cats to get a standardized diagnostic criteria and treatment protocol, and then we've got, the social implications of what happens when you have had it.
It's separate.
I know in the beginning I was afraid, that I was apprehensive about sharing my status because of that fear of being treated as a leper in my community, and then hearing on the news how people were reacting to, especially because I'm in Texas, to other people. So I thought long and hard about it before I came out. It wasn't just something that I did with ease.
I will tell you, Margot, that I actually videotaped myself as well, and that never made it to the internet. So I applaud your courage.
That's amazing. I mean, we all have to, though, because we are willing, really look first to see and decide if it's safe and be, be watchful. I mean, I went in someplace with my scrubs on after work and people were nasty. Like, what are you doing in here? This whole stuff about how, oh, the heroes, that's so silly, that's so disingenuous. It really is not a thing, It's part of that whole avoidance thing. But, well, you guys are amazing. I mean, courage, persistence, awareness, dedication, amazing. And Dr. Margot is going to be a storm runner, a storm chaser, or the storm is chasing her.
Storm runner.
I'm not going to chase any storms. I'm out of here. No way. And I don't want to get stuck here either. So I'm not going to ride it out.
Are your kids homeschooled this year? Are they online? Okay.
We were always I always homeschooled my children. So my life wasn't really impacted very much with the no school. Even with, the professors who were transitioning to online learning, my school is heavy with online lessons. So that was never really an issue for me. So had I not gotten sick, that would have just been great, but it just didn't work out that way. So for me, it was a total lifetime, it was a big change for me in my life, this past period.
Right.
You're balancing so much. I mean, between work and kids and dealing with illness and whatever else. I'm afraid to go to Texas in general. So, and that's only because I'm a Jew. So there. I mean, there are places I just don't go. Oh, so you guys, this is really amazing. I know Val needs to go, and I'm so grateful. Amy, anything else that we should add that I ADD'd away?
I don't know. I feel like, of course, I'll probably think of something later, but that's good.
I do have a question for you. So are you saying that, are you still sick 11 months later? Is that, do I understand you correctly?
I wouldn't really call it sick, but like my breathing's not the same. So I might be hyper aware because I'm an athlete. So I have, weirdly enough, I have 3 jobs. I do neurodiagnostics, comedy, and I also do professional mascotting. So I work in professional sports, and I always, played competitive sports. So I can just tell, it's like, knock on wood, I'm okay, but it bothers me because I get so out of breath. But I'm able to do my day-to-day activities still. My professional mascotting, there aren't pro sports. So, I mean, there are, but, not live events. So since I'm not working those so much, there is some virtual stuff. It hasn't really affected my day-to-day much, but I definitely can tell it's there, when I try, to just do cardio that's more intense, like jogging, or I don't really go to Krav Maga anymore, but I'll do it at home, and that's when I can still tell. Yeah.
Do you still have chest pain?
Not really so much. It's more just the out of breath, and then I get kind of more tired too. Like Valerie's analogy of a dog that just wants to stop.
You still have fatigue?
Mm-hmm. Yeah, okay. When I'm doing cardio. Yeah.
But okay, so when you're
my day-to-day, knock on wood, I don't think so really. It's just the cardio and steps and anything that where I have to exert myself will actually where I can tell.
Okay.
But I'm hoping maybe, I'm allergic to grass. I'm hoping when the ground freezes, maybe it'll be a little better and that'll give me some relief to heal.
So does the breathing feel? How does the breathing feel compared to when you have your asthma usually?
It's kind of similar. But so usually when I have like asthma, like when I lived in Texas, it was the worst. I actually lived in West Houston, right on the border there, Houston. So like, then it would be, just so out of breath. But now the feeling is more, it's out of breath, but it's that feeling of like your body kind of getting more like tired from being out of breath. Whereas before I was out of breath, but my arms and legs could still keep running, but I just couldn't catch my breath. And then I haven't really been pushing myself hard with cardio because I've been trying to like, I don't really have the best insurance. I've been trying to find like a doctor to follow up with. So all I've been given so far is an inhaler, and that's it. Yes, I haven't been pushing myself as hard, so I haven't noticed the blood taste in the back of my throat. That was the most concerning. But I had that like months after, but I haven't been pushing myself as hard to see if I still would have that. I've been doing milder cardio, like just longboard, skateboarding, and stuff like that lately. So
From the fatigue part, though, the fact that there's fatigue, I would bet that you're desaturating more. It'd be interesting to see like what Val's talking about.
yeah. Oh, one thing I forgot to mention too is so I use like, I'm a really heavy sleeper, and I have to get up. My schedule's all over the place, with comedy in the hospital. The hours are nighttime and early morning. So I use like a sleep tracking app that it goes off your breathing to estimate what stage of sleep you're in. And twice, I didn't even put two and two together right away. I've had the sleep, app say dangerously low for, like it will show my sleep and it says I'm in a dangerously low deep sleep. So at first I thought it was an error with the app, and then it happened again. And then I started to think, well, maybe it could be something with, maybe my breathing is getting.
I've had that exact same thing.
Have you?
Yeah, and my pulse actually will go into the 40s in my sleep.
Wow.
And, something that Dr. Margot said, I have gone to sleep really afraid. I've gone to bed afraid that I wasn't going to make it, that I was going to die during the night because of my breathing and my heart rate.
Yeah,
So possibly sleep maybe some of that fatigue is coming from hypoxia and sleep apnea.
Just did a sleep study here at home the other day. So
yeah.
I also have one of those wonderful arterial pulmonary stress tests coming up. So.
Oh, that was awful. I just did that. That was awful.
Yeah. So for anybody who doesn't know what that is, they run a line into your artery and they measure your oxygen while you exercise. So I'm looking forward to that.
I had that one years ago, and I don't remember it actually being that bad other than having to sprint for so long. That was the worst part on the treadmill. That was actually, speaking of the gaslighting, I had after Hurricane Katrina, I needed my gallbladder out, and I was told I was a hypochondriac by a bunch of male doctors, and because I didn't have stones. And so eventually, once I got out of Louisiana, I got a female doctor, and she did a HIDA scan, and I think it was functioning at like less than 1%. And so then when I got the surgery, I wasn't very high on the list since I have stones, but my dad happened to know like a friend of a friend who was a doctor and worked in GI and surgery. And when they took my gallbladder, they said it was so infected I would have been dead in like a couple of days. So like, it is scary how the gaslighting can really like, almost, it can kill you really if you're not careful. So yeah, it's good to always remember you have to listen to yourself and be your own advocate.
And there, absolutely. And there is that part of this, as Margot was pointing out earlier, the psychological impact of this does create a level of depression where it's actually harder for you to advocate for yourself. And you end up, there are times when I think you feel so miserable that it's just like, it's not even worth it, When my 90-year-old dad actually had that. He lost all his taste and smell, stopped drinking, stopped eating, and he's just like, he had given up. He was making lists of things for my mom. And we joke about it now because he made it, but he literally was making a list of how to take care of the lawn. And in 63 years of marriage, my mother has never mowed the lawn. So, at the time, he was just, that's how miserable COVID can make you feel. And you just don't have it in you to advocate. And if you don't have doctors that believe you, I think that there are a lot of people in that position. All of us are privileged enough to have access to some care. So, oh, Ellen, you're off. Uh-oh.
There we go. Yeah. Nope.
Nope. Ah.
She's lost her voice.
Yes. We'll have to start telling jokes.
Yeah, right. Have you been doing any Zoom comedy?
No, I'm barely getting through my work.
Yeah.
I was amazed to hear that you actually exercise. It wouldn't be possible for me to do that. I feel like sometimes some days that I'm walking on rocks, like I feel really bodily pain to be able to exercise. I'm impressed.
I'm stubborn, so it wasn't, and in hindsight, it wasn't a smart thing for me to do and I'm reading this on the long hauler boards. I don't know if you've seen it. There are a lot of people that are saying that their symptoms worsen after the full exertion, and that's exactly the case. So I'm done. I'm not running. I'm not exercising. So Ellen has texted us that her sound is not working, which is too bad. I'm so sorry.
After we were just talking about women using their voices.
I know. And on that note, so Ellen, thank you for having us. Thank you for hosting this forum. I think that these are important, interesting conversations for all of us to have and to be sharing with people who are experiencing this, to give people information as well as validation in a safe space. So thank you for creating this.
Yeah, absolutely. She got this amazing group of smart women together. That's nice. That all were sick. That's, for me, I learned something today. So it's great. I was glad to take part. So
thank you so much.
All
right. Well, guys. Everybody. Thank you, Ellen.
Thank you for having me. Bye-bye.
Bye-bye.
I think she's back. Bye.
Bye.
Bye. Yeah, bye. Bye, Ellen. Thank you for having me. I appreciate it. And please, can you connect with the woman, the clinician, if you remember? Ellen.
Which woman?
Okay. Can she hear me? Can you hear me? I hope so. Yeah. I'll text her. Okay.
Quiet, yeah.
Thank you. And thanks for sharing your story. It gives me hope that 11 months, I'll be able to do something.
Yeah. I've been skateboarding and moving around. I haven't tried to do intense crowd, but we'll see. Maybe I will.
Okay.
So, so there's some hope.
Thank you. Good to hear. Bye-bye.
Good talking to you.
Safe.
Bye.